Addiction is a complex brain disease, and we know that there are many factors that contribute to determining whether a particular person will become addicted. Many of these factors are things we can control, some of them are things that we can't. Some of them reside in the individual, some in the family, some in the society. Genetics, we know, is a very important factor, and it accounts for approximately 50% of a person's vulnerability to addiction. Having a blood relative who has an addiction makes you much more likely to develop an addiction yourself. Having a certain temperament, for example, people who are just naturally risk takers are more likely to become addicted. Having a co-occurring mental health disorder, such as anxiety, depression, or attention deficit disorder, can make you more likely to develop an addiction. And having inadequate coping skills to deal with those kinds of problems also make you more at risk. Family situations such as divorce or having a family member who uses drugs and alcohol or who has a mental health disorder also can make a person more vulnerable to addiction. A lack of parental supervision can contribute. Certain societal factors such as the accessibility of drugs and alcohol in a community and the lack of firm guidelines about use and enforcement of those guidelines can make a person more at risk. There are also protective factors, things that decrease one's risk of becoming addicted. Things like involvement in a church or other religious organization, for example, having strong family ties, also make it less likely that someone will become addicted. The age at which one starts using is very important. People who use younger have much more likelihood of becoming addicted. Knowing a person's risks and protective factors can help that person to make better informed choices about their use, and as a society, addressing the risk factors and strengthening protective factors, especially for vulnerable youth, can lessen the impact that this disease has on our communities.